Well, the title of my presentation is Observing Park Environments in Nevada, and we were really privileged to have a whole lot of collaboration on this project. It's a project that was 1 year in its conception and 1 year in data collection, and now we're moving into some serious time for data analysis. So there's a lot of data here that I won't be presenting that were collected. But there were a lot of people who were involved, and I want to acknowledge my 2 graduate students, even though they're not here right now. Without their help in coordinating this effort, we would have never, I think, have gotten where we were. I want to talk a little bit about TUS, and just to acknowledge the fact that the Physical Activity Policy Research Program has a community advisory board that consists of chronic disease organizations as well as public policy folks, as well as local foundations, and considering sort of local government agencies. And through that advisory board, we talked a little bit about the stakeholdership of physical activity, and it was identified that we really need to know more about what happens in park and trail environments in southern Nevada. And so that was the focus of the effort, and it was because of their advice and wisdom. So through their vision and recommendation, that's really where this came from. And then, of course, the stick-with-itness, leadership, and commitment of Melissa Clary and Susie Quintana from the city of Las Vegas. And I really have to acknowledge Justin Williams and Bruce Silito from the Clark County Comprehensive Planning Department. These are the people that really drove this program. They really believed in the notion of being able to collect direct observation and data and be able to have objective measures of physical activity was really important to what they did on a daily basis, and could really drive some of the decision-making capacity for what they did. And they actually trained staff. So staff were really part of this. There were over 42 staff members from the city of Las Vegas and the county who actually became trained on the SOPARK data collection methods. And so without their leadership, this would not have happened. And then certainly funding from the UNLV College of Education and the Lincy Institute made all of this very possible. Before I talk to you a little bit about the park study and what we found, I want to talk to you a little bit about why we ought to be concerned about what happens in parks. And I think most of you probably realize that physical activity is important for our health, but many of us don't necessarily understand, really some of the epidemiological work that's gone in front of this, and what kind of compelling evidence there is for this. And so we have about over 50 epidemiologic studies that show an approximate almost double relative risk for coronary heart disease. We have several cohort studies that have showed about a 30 to 40% increase in risk for diabetes. And then, of course, about 30 studies have showed an inverse relationship between physical activity and colon cancer. And most people probably don't know this, but inactivity is related to about 200 to 300,000 preventable deaths each year in the United States. And so worldwide, we also have this problem. This is a global challenge, that it's also estimated to be responsible for about 3.2 million deaths. And this slide for the World Health Organization really kind of gives you a sense of where we're at relative to other leading risk factors. And you can see physical activity ranks 4th. And it affects everybody, even high-income folks, as well as middle income and certainly low income. And this is something that we're grappling with globally, not just here in the United States. So I wanted to give you some perspective a little bit about the fact that, well, how active are we? And across the lifespan, you can see these data were measured by accelerometry. So this is an objective measure of physical activity that measures how, in terms of intensity, how active we are. And so these are minutes per day of moderate to vigorous physical activity. And you can see across, the different age spans, age 6 to 11, all the way to age 70. And you can see that as people mature and across the lifespan, we get less and less physical activity. And certainly females, especially here with the onset of adolescence, we can see that there is a real drop and decline, and it stays pretty consistently low, and certainly comparatively for females are much lower than males. So this is a population we ought to be concerned about. You might be asking yourself, well, what are we really doing about this pandemic of a problem of physical inactivity? And most of us probably realize that we have a lot of interventions that are guided by theories that are focusing primarily on psychological and social influences of physical activity. And from those studies, really our primary goals have been to try to educate people and to try to work on their behavior change skills. But if we look at the trend in physical activity overall from 1986 to now 2000, we can see pretty much flat line. There's not really a lot of these efforts have not been really working to change population level physical activity. And so we're really moving toward models of ecological models of changing health behavior, where we're really trying to still incorporate the individual, thinking about their biology, their psychology, and behavioral skills, and still considering their social and cultural. But now we're really starting to examine physical environments where people live in about 4 different domains. So we're looking at households, transportation, occupations, and of course leisure time, and how people spend their time. And we also are very concerned about these environments and the policy context that exists within them as a way to try and change population level physical activity. And the notion behind these ecological models is really, how can we make physical activity the easy choice in considering in our communities, our built environment? I think many of us have heard about the built environment and how many of the challenges that we face on a daily basis really default our behavior into sedentaryism. This is true in the way that we've designed our communities, and a lot of the technologies that Bo talked about are things that really default our behavior into a lot of sedentary time. School and occupation settings, of course, we're a large focus on those, but also recreation facilities. And just to give you an idea of why we ought to care about parks in relation to health, this study really illustrates that the number of facilities per block group makes a difference in how active. This is the odds of being obese, this red line here, and the odds of having 5 or more bouts of moderate to vigorous physical activity. So if we take the blue line, the more recreation or physical activity facilities there are per block, you can see that we have a greater odds of having 5 or more bouts of moderate to vigorous physical activity per week. And then in addition, we can see that as those opportunities or facilities for physical activity increase, we have a decreased odds of being obese. So this is important for us to consider that, activity spaces and facilities are important in the way that we design our communities. And so you might be asking, well, how do we really compare? And you may have heard of the American College of Sports Medicine annually does a fitness index. But it compares the 50 largest metropolitan areas, and these are our data. And so you can see that comparably, nationally, we're deficit city land designated for parks, and we're deficit parkland per 1,000 citizens compared to the 18.9% per 1,000 citizens nationally. And the Urban Land Institute even recommends that ought to be about 25 acres per 1,000 citizens. So other park and physical activity disparities that we have are, we have a lower percentage of citizens who are biking and walking to work. We have lower requirements for physical education. And per capita, we have fewer ballpark diamonds, fewer playgrounds, fewer park units, and fewer tennis courts. And so these are things in our own community that we're really grappling with. And so the notion here is really that parks are important locations for population physical activity. And this is true especially for low-income families, children, and seniors, because they're free and they're open to everyone, and they're in our communities, even though we may be deficit compared to some of the recommendations and compared to some of those metropolitan cities. But what's really interesting about this study is that parks are really seldom viewed as resources for health, and they're very seldom assessed for the physical activity they provide. So that was the purpose of our study here. In Nevada, we have never studied physical activity in parks or really understood their design and how they might engender more physical activity for Nevada citizens. So this is a very unique study. So thank you, Lincy Institute, for funding it. So our notion here was to try to look at physical activity, and our thought was that we wanted to really try to understand how those health impacts can be translated into local government services. And we really had this overall question: in lower income Las Vegas neighborhoods, how are parks and trails really being used, and how are they perceived by residents? And our goal here was to try to figure out how we might optimize the investments that we have in parks and trails for health-related purposes. And so these are the parks and trails that we studied. The city of Las Vegas had 2 parks and 1 trail, and the Clark County had 4 trails and 4 parks and 3 trails. And so we have about 10 environments we studied for a period of 1 year. And just to give you a notion about, what were the demographics and the zip codes where these parks were located, we wanted to provide you with a little bit of their acreage here and the total population that these parks are serving, and a little bit of background on the household income, and what percentage of those folks who are living in the zip code were of minority status, and what the employment rate was. And so you can see that we have, clearly some disparities in income in these areas, and lower income in this area, and then probably like a mid-range income going on here. Trails, same kind of data here going on. So we have a large portion of the population, obviously female, and of course median household income with the wetlands trail over there by, I don't know if you know where Sam Boyd Stadium is, but that's where the wetlands trail is, near there, and certainly giving you an indication of the transiency of the neighborhoods in these areas where these trails are located, and of course the percent minority. I want to talk a little bit about the data sources used in our study. For direct observation, we use a system for observing physical activity and recreation in communities, which is developed by Tom McKenzie and Deborah Cohen from the Rand Institute. And they've been doing quite a few studies nationally, and they're starting to do some things internationally with really studying park environments and how they might, when we might start to assess health impacts of parks. We also collected intercept interviews with people who are using the parks, so we wanted to get some perceptions from them. And then additionally, we wanted to get some opinions for people who are living in those areas near the parks, or about a 1.5 mile radius. So we did questionnaires and focus groups with residents living within those areas. So park data collection, I want to let you know that this was over 1 year, and we looked at different seasons. There were about 3 different seasonal time periods, and we did that by ranges of the temperatures, because we don't have straight-up seasons here a little bit, it seems like, at least in Nevada since I've been living here. And so what we really did is looked at temperature ranges and tried to look at these different ranges in the periods of months where these ranges were kind of delineated some seasonal changes. And what we did is we wanted to assess 2 weekdays and 2 weekend days during these 3 seasonal times, which really translated to data collection on 12 clement days in each environment over 1 year. And each day we collected data, we collected the data during 4 time periods, so at 7:30 a.m., 12:30, 3:30, and 6 p.m. And we did this because other studies have shown that these snapshots really provide us with a pretty good representation of what park utilization is like, and that came from Deborah Cohen and Tom McKenzie's work. In total, we made about 480 area visits, and we did collect inter-observer agreement so that we had an understanding of how reliable our data were, and we had some outstanding reliability here. So reliability ranged from 92 to 100%, and when I sent these to Tom McKenzie, he was elated since this is his instrumentation. So we feel pretty confident in the data that we have. We also have intercept interviews and residential surveys, and we did online questionnaires were sent to randomly selected residences within 1.5 mile radius of the parks. And we also conducted interviews in all 6 park areas that we would love to do that on trails, but people were typically moving on bikes swiftly and weren't going to slow down for any type of a interview for us, so it was really difficult to do intercept interviews with people using trails. But just to let you know that for the number of surveys that we sent out, we had an enormous challenge getting response, because this is the first time we've ever done a study that was really a random selection of residents who are living in an area that didn't necessarily have a specific connection to our study. So it was a lot more challenging than we thought, and our sample yielded about 250 completed surveys and interviews. We also conducted focus group meetings. We did a total of 10. Each focus group had anywhere from 5 to 8 participants. And we had different focus for our focus group meetings. We wanted to learn more about trail use, so a couple focus groups were specific to trail use. Specific focus groups were on parents, Hispanics, senior adults, and women. We also audio recorded and video recorded these focus group meetings, and we transcribed these data and coded them. So let's get to the data and what we found. So first I want to talk a little bit about how parks and trails are being used in southern Nevada. And these pictures are actually from some of the parks, so that's kind of interesting, with some Hispanic children playing and also an ice cream vendor. I have something for you, little boy, little boy. Overall percentage of park users by age and age group, I want to tell you that we observed over 33,000 people in southern Nevada parks over those 480 visits. And of those people, we identified that the park users really ranged, but in every age category, you can see that males were using the parks more than females. And again, that corresponds with our activity data we talked about earlier. And in addition, we have a lot higher use from adult populations and much lower overall from seniors. Only 6% of the people that we observed were seniors. This is our trail data. Now, there were only 817 people observed in the entire year for trail use, and that's very concerning, and we'll talk about those data and what we think is going on there. But you can see again here, far more use on the trails by males and adults in general than any other age group. Park physical activity levels, these were the number of people who were observed being sedentary, walking, and vigorous. And you can see, again, more males in every category and much more vigorous activity from males than females. We'd really like to see that more parallel. And on trails, you can see that a great deal, not much sedentary behavior going on in trail environments, a lot of walking, and a lot of vigorous activity. So this is really great. Trails really demonstrating what we thought they would demonstrate, that they have the capacity to provide a great deal of activity, and including vigorous activity. We wanted to know a little bit about when people are using parks and what their use patterns were like. And so what I've done here is provided you with a snapshot. So of the 100% of children that we observed, where were their use patterns, either in the evening, afternoon, lunch, in the morning, and same thing for teens, and same thing for adults, and same thing for seniors. Now what's interesting about this is that you see the use pattern for senior adults is very, very different than any other age group, and that seniors have a tendency to be present in the park during morning hours and lunch hours versus any other age group, and that's kind of compelling. Everybody else seems to be using the park more so in the evening than any other time period. We also wanted to look at seasons, and you can see that in the summer months, we kind of wondered whether this was going to be a bit of a challenge, but in the summer months, maybe perhaps people have more time. But we observed more people there, and except for during the more colder months, and we observed a lot more seniors, but still, relatively speaking, senior adult use is just really not very prevalent in the parks that we observed. I wanted to give you a perspective of the trail use and the time of day that people were using trails, and you can see that trail use, again, is really during the time periods where people might be commuting in the mornings and in the evening here, or later afternoon, and then of course some in the evening. But trail use in general is, pretty steady across the board here, except for in the 6 p.m. hours where a lot of these trails that were in our study did not have lighting. Trail use also by the seasonal time, so in the winter, spring, and the summer months, you can see a lot more happening in the winter versus the spring months. So, and I tried to ask the Clark County folks to see if they could give us an indication why we observed absolutely no one on Wetlands Trail during the spring, and we sort of attribute that to maybe there being a lot of construction going on at that time, but there was no closures, so there's just some things going on at Wetlands Trail that we'd like to learn more about. I wanted to talk a little bit about the park spaces that exist, because most of the parks, as you saw, have quite a few acreages, and we wanted to learn more about where people were spending their time. And you can see that the general areas had a good deal of people present. A lot more males, however, in every category, except for the playgrounds. And this is really nice to see, because playgrounds, as you'll see in a moment, is one of the places where people are getting a lot more moderate to vigorous physical activity. But there's also, in every case, every one of these cases, that there's a lot of different kinds of activities that go on there. Some activities are engendering sedentary behavior, and some are engendering more moderate to vigorous physical activity. So let's look at these park areas and then try to talk about what's going on there. Okay, in the general areas, you can see that there's a good deal of moderate to vigorous physical activity going on, but also a lot of sedentary behaviors. And general areas included things like walking paths and grassy areas where there might be a tree and a place to lie down. Soccers, these are all sport fields, baseball, soccer, and you can see that you might think that mostly moderate to vigorous physical activity happens in soccer, but there are a couple of reasons why people come to parks and come to the soccer area, and that is to participate and also to spectate. So people are coming to the parks to be spectators as well, and this is true for a lot of these other areas. So you have spectators and you have people who are engaging in the activities. Okay, and this is true. The dog park was really interesting for us as well, because we have a lot more sedentary behavior than we have moderate to vigorous. We also wanted to try to understand how much these park areas are programmed, because we know from other studies that when these areas are programmed, then we have a lot higher use. And so we're really trying to identify that there's not a lot of programming going on in these park spaces. Very few times where we observed what was going on in the parks was either supervised or organized. But they're always accessible. So here's some perceptions. There were some barriers relative to safety from hot temperatures. People felt like the parks were pretty well maintained, but they also felt that there might be some disparities in what was in parks in low-income neighborhoods. And people also felt like that safety could be increased if they would have police presence that would actually physically get out and circulate the space. And women and parents had concerns about park use in the evening. But overall, people felt like the parks were pretty safe. And we did not, from our focus group meetings, identify that park utilization, that barrier to park utilization is really an artifact of of feelings of not being safe. The major barriers that people reported were the lack of time, and of course other things and work commitments really got in the way, and that really explained what people said, the reason why they don't use the parks more. And when we asked them what they would prefer to do when they're in the park, you can see a large proportion of the adults that we interviewed or talked with, or the residents, identified that walking was their most preferred activity. They like to do dog-related activities and playground activities. A lot of these activities here, playground, playing with kids and sitting in the park and being social. I want to talk about these things a little bit later, but you can see people want to do these things. And so, do people know about the parks? This was another question we asked. Where did you learn about the parks? And most people said that they found the parks simply by driving around. Some people learned it from a neighbor or by word of mouth. And some people learned about parks programs through schools. But they also identified that there's a lot of opportunity to promote parks and park programs by working collaboratively, perhaps with apartment complex managers, by having postcards or mailers, perhaps working with utility companies to send that out in the utility bills. And then, of course, continuing to work with schools. So let's talk about what we found as an overall part of this study and what we're really talking about now with the city and the county. First of all, most of the people that when we compared users to non-users, we identified that most users were much more likely to be low income. And so this really means that this is a critical venue. Parks are a critical venue for addressing health disparities, we believe. And of course, as you know from all the slides that I just showed you, that more males and adults were using the parks and trails, and that most people were observed sedentary. But there was a lot of moderate to vigorous physical activity on trails. So this is something we need to think about more. And of course, in every situation, there were more males present than females, and they were more active. So the other point that's really important to understand about the potential of optimizing our parks and trails is that parks are really rarely organized and they're rarely supervised. So lots of opportunities for programming there. In parks, females and seniors were relatively underserved, and so women really emphasized that there's a lot of time challenges. They're very busy after work and getting the children and running them around, that it's difficult for them to get to the park or any place where they could be physically active. And we also identified that seniors, remember their patterned use was very different from everybody else. Seniors told us that they felt unsafe being in the parks with other age group, especially if there was a large group of rowdy teenagers or people who were not like them. That was a barrier for their use. And this was true also for Hispanic adults who told us they felt more comfortable being around other Hispanics. Again, these are these ideas and these notions should translate into program targets, we think. It appears that strategies for increasing physical activity in parks for busy adults, especially women, should really concentrate on efforts to address time efficiencies. We really think that there's opportunities. Remember I showed you at the dog parks, dog parks and the park spaces where children would be, that people come to parks to not just participate in activity, but they come sometimes to supervise and they come sometimes to spectate. And can we capture those individuals in being more active and having active spectatorship and active supervision? So we think that time efficiencies perhaps could be addressed in increasing people's physical activity by redesigning park facilities to include walking paths around the perimeter of park spaces. And we think that's an important strategy, one that we're talking with about perhaps redesigning and doing some experimental studies to see if we can increase physical activity in those specific target areas by redesigning. And then strategic programming, where we might be able to think about how to redesign our programs with the family in mind, where we're having maybe soccer programs for kids, and at the same time in the adjacent target areas, we could have programs that are targeting the participation of adults. For example, a yoga class could be going on in an adjacent space to that soccer practice. And then increasing the number of programs that appeal to females, seniors, and Hispanic adults is very important as well, and really thinking strategically about where those should be timed in the day, and of course, thinking about what people said they were interested in doing, and primarily walking. Trail use was highly active, okay, but we also identified that there was really a lot of low use. And during focus group meetings, people told us that they felt like there was a problem with trail connectivity. And if you're familiar at all with the trails that were in our study, you know that the trail does stop and it does require people to cross busy traffic intersections and sometimes railroad tracks. Linda and I were talking about that earlier. And that's a barrier to people's use, even though the trail continues somewhere else, especially when you're thinking about children and families. And then knowledge, general knowledge about where the trails are. People said that if we really want to engender general public knowledge about trails, we have to provide more community events. We might want to think about farmers markets that could take place there, or other community festivals that could take place on a trail to introduce the community to these trail environments where they might actually become familiar and use them. Park and trail promotion is really needed, and most people found parks as opposed to being informed about them. So we really believe that promotional efforts should appeal to this notion of the sense of community and people's opportunity to socialize, but also make sure that we're providing activities that people are interested in. And then again, we identified that there's some potential promotion partners that we haven't really necessarily thought about, which is these apartment complex managers, who are very prevalent in low-income neighborhoods where these parks were, and of course schools, and perhaps mailers through the utility companies in forming some partnerships. I want to let you know that as a result of this study, we've been talking quite extensively with both the city and the county, and we are planning an open community forum, and we will have local policymakers in both the city government and the county government who will be really looking at these data and trying to think a little bit more about what we need to do next and what they're really telling us. This community forum is going to be held on January the 25th from 10 to 11:30, and what's really exciting about this is that we have Mayor Goodman will be responding to the city data, and this is part of her Healthy Communities initiative. In addition to that, we will have commentary from Commissioner Brager, who obviously is a very strong proponent of parks and trying to optimize the parks that we have for health-related purposes, but also to think strategically about how we might build future parks in Nevada. So we think from the results, the next steps might include new strategic partnerships, probably with public health and local and county government. And in addition, we're thinking about doing some experimental work to address some of the park redesign issues that we talked about that might increase individuals' physical activity when they're there. And of course, the strategic programming ideas that we talked about. And then of course, we want to think about partnerships to promote parks in a low-cost, no-cost kind of way through these partnerships where people can become more familiar with the physical activity facilities in their neighborhood and what kinds of programs are available. We think that, we hope that from this work, that the city and the county will join forces and really think about trying to have a Las Vegas active living task force. We're kind of talking about the potential now. And so we're going to continue robust conversations about how we might retrofit the built environment of the Las Vegas community and the surrounding communities so that we can address the physical activity challenges that I talked about in the very first part of my talk. So as a last slide, as a point of just where a frame of reference of where I'm coming from, that I really believe in happy, healthy families and their right to be physically active. And these are two members of my family, my son Payne, age 8, and my daughter Victoria Lounsbery, who's a freshman here at UNLV. And the idea behind all of this work is that we need sustainable, creative policy responses to make physical activity possible for people. And I appreciate you sitting in with me, listening, and of course being open to these possibilities. Thank you.